Habari yako?
Nzuri.
Naitwa nani? Unakuja kututembelea kwa hii hospitali yetu ya JM. Unakuanga na ugonjwa wa kisukari. Ulianza kuja kututembelea lini? Kana kama miaka ngapi?
Kwa 50.
Umekuwa ukikuja huku kwetu kama miaka ngapi?
Miaka 5.
Na ushawahifunzwa kuwa kuna complications ambazo zinakuja wakati uko na ugonjwa ya diabetes?
Hapana.
Okay. Mimi naitwa Emma, nafanya kazi hapa kwa JM. Kuna survey tunafanya kujua vile watu wenye ambao wanakuja hapa kwa na ugonjwa wa diabetes wanatibiwa ama wanaangaliwa complications zao. Na sisi tunashughulikia ile ya ugonjwa inaitwa Nephropathy, ambayo ukiwa na ugonjwa wa kisukari ina affect kidneys zako. Na ushawaitumwa mara kama 1 ama 2 hivi kwa lab kuangaliwa? Safari moja. Ukaambiwa na daktari majibu yako iko aje?
Nzuri.
Okay. Sasa unafaa kuwa ukipimwa kila mwaka mara 2, ndio unajulikana vile ambavyo dawa zinafanya kazi na kama uko na any infection kwa kidneys. Na sasa tutakuwa tunaangalia kama umepimwa kila mwaka, una make sure umepimwa mara 2.
Nimeshukuru kwa kujua, juu sikuwa najua, na nimeshukuru sana.
Sawa, asante sana. Na uendelee kutumia dawa inavyostahili. Asante. So, good afternoon. My name is Emma Nyandarua, Team JM. I have been working on diabetic complications in JM Kariki Hospital, and our target was to increase the proportion of diabetic patients from 15% to 50%, and the current state is that the prevailing screening for diabetic nephropathy is at 15, that is 72 patients out of 468 patients. The target for the 4 months, that is starting from May, is 50%. The existing gap is at 35%. The weekly target is a 2% increase. So we did our analysis where we used the fishbone diagram, the people, process, equipment, management, environment, and materials, and we came up with several causes, and among them we found out that we didn't have a screening tool, and this was to help the clinicians to be able to screen the complications. And in that, we developed a screening tool, which we implemented in the month of May. We also found that there was no awareness for the patients, and we needed to do CMEs to educate our patients and create awareness. And this one, we analyzed our data using Pareto charts. And the other key driver, we found that we needed to do capacity building, that is training the healthcare providers. We also developed a key driver on strengthening the healthcare system by standardizing care and enhanced communication, carry out data analysis, and ensure there is data-driven improvements. We developed a run chart, which we were able to get the baseline data, and this we did by collecting data from the month of January to March, whereby we came up with 15%. From there, we implemented our key drivers from the month of May, and there was increase up to 50%. Among the interventions that we were able to implement is that all of them were able to work out well, but individually we can't say which one worked for us. So that is a lesson that we learned. In awareness and education, the number of education sessions that were to be conducted per quarter, and in the month of May and June, we conducted 2 CMEs. In Test for Change, we wanted to assess the success in improving diabetic nephropathy screening at JM Kariuki, which would entail baseline measurement that we did from the month of January to March, and identify the current state of diabetic nephropathy screening. Number 2, implement intervention by carrying out the intervention outlined in our sustain plan by ensuring they are implemented correctly and within set timelines. Number 3, to collect data, that is continuous collection of data on the identified indicators throughout the implementation of the interventions. So the other one was compare data, comparing the post-intervention data with the baseline measurements, analyze results. We're also supposed to assess the outcome and also engage stakeholders in gathering input and feedback from the key stakeholders. This includes the healthcare providers, patients, and community members, as their perspectives can provide valuable insight into the effectiveness of the interventions. So thank you very much for listening.